All right, good morning again. So, November is the National Diabetes Month, and as we like to do, we try to raise awareness. I don't think we can talk enough about diabetes. The more we talk, it looks like it's still growing, so we have to definitely pay probably more attention. Now, last year we've had the three-part series. We went into more detail, so today we'll try to just kind of share some reminders about diabetes and how important it is to really pay attention, and that's something that we can do about it. There is hope. So, causes, in order to understand diabetes, we need to understand actually how the body uses the glucose. So, I'm sure you know about insulin, right? When you hear about diabetes, you always think of insulin. So insulin is a hormone that comes from a gland called pancreas. And then the pancreas releases insulin into the bloodstream. The insulin goes around, kind of opens the doors of the cells. It's kind of like that key that opens the doors to let the insulin go in and do its job. And then when the insulin lowers the amount of sugar in the bloodstream, because if we keep having it in, that's when the problem comes. So as the blood sugar level drops, then insulin also drops. We don't need so much insulin. Now, the role of the glucose. So glucose is a sugar, is a source of energy for the cell. So whatever we do, we need energy to perform our duties. So helps with our muscle contractions, in a lot of things. So glucose comes from two major sources, food and the liver. So sugar is absorbed into the bloodstream where it enters the cells with the help of insulin. As we said, the insulin is that key that opens the cells for the insulin to go in. Now the liver stores and makes glucose. So whenever we don't get to eat much, so there's always a little reservoir there when we can still function, even though we might not have eaten a lot, we can still function because we have some reserve there. So that's when the liver starts breaking down the stored glycogen, so into the glucose. So that's how we keep the glucose level within the normal range. Now, what causes diabetes? As I said, if there is a lot of insulin that goes around and they don't enter into those cells where they're supposed to be, that's when the problems start occurring. Now, there are different types of diabetes. We won't go into all of them at this time, but one of the causes is the insulin resistance. And the type 2 diabetes, which most of the diabetics are about 95% result from the insulin resistance. So the insulin resistance happens when the cells in the muscle, fat, and liver don't respond as they should to insulin. So several factors and conditions contribute to this. Things like obesity, lack of physical activity, diet, hormonal imbalances, genetics, and certain medications. Also, autoimmune disease. We know type 1 diabetes happens when the immune system attacks the insulin-producing cells in the pancreas, and they are not doing their job, so that's when type 1, and that can, now we are seeing type 1, even I've had a patient, 50-year-old, diagnosed the first time, type 1. I just had last week a patient, 5 years old, type 1, the first time. So we are seeing now at every age, which is kind of interesting. Now also hormonal imbalances. We know that during pregnancy, the placenta releases hormones that causes insulin resistance and have the gestational diabetes that develops if the pancreas can produce enough insulin to overcome that problem. So there are other hormone-related conditions that can lead to diabetes, like acromegaly, the Cushing syndrome, and also, type 2. Now, there can be another problem if we have any damage to the pancreas. So that can be accidents, physical damage, or surgery, or any other damages that we do to pancreas, and it stops its ability to make insulin. Also genetic mutations, and there are some long-term use of certain medication. Remember, I said long-term use, not just when you have to use a short-term. It's long-term use of medications like for HIV/AIDS, and also long-term use of corticosteroids. That can lead also to type 2 diabetes. Now, we are seeing all these like a horror movie, all these problems. Is there any hope? Yes, so the CDC reports that more than 38 million Americans have diabetes, 1 in 10, the ones that we know about. And they are mainly type 2, that, as I said, 90 to 95% of those cases. Now, medications are a major component of type 2 diabetes care. Now, we have a lot of research that supports the evidence that lifestyle intervention also play a big role, especially whole food plant-based diet, exercise, decreased substance use, proper sleep can have similar significant health outcomes as pharmaceutical interventions. I've witnessed, when I worked in a lifestyle center, I witnessed people reversing their type 2 diabetes. Now again, some people reverse it faster than others. Some, they manage to keep it at a level that is not as severe. And also, it depends for how long you've had it, how much damage to the cells in the pancreas. So there are different factors, but a lot of people have done quite good with it. Now, this is how it looks. About 38 million, about 1 in 10 people have diabetes, and it's about 1 in 5 who actually don't know that they have it. So from what we talked last time, I remember it takes about 12 years to really for diabetes to be diagnosed. So there are a lot of people walking around with diabetes without even knowing. So, and now, just to kind of give you an idea, because when we talked about whole food plant-based diet, just to give you an idea how 500 calories would look like and why is it important when we talk about diabetes. As you can see, oil, tiny bit cheese, meat, potatoes, fruit and veggies. So kind of pick your battle. And it looks like the more plant-based foods we eat, the better for the body to deal with conditions like diabetes. Now, adopting a whole food plant-based lifestyle can help people with type 2 diabetes achieve remission or significantly decrease their reliance on medication, according to a new study published by the American Journal of Lifestyle Medicine. And as you know, I took the course with American College of Lifestyle Medicine, and I've witnessed quite a growth into a lot of providers that are adopting now and prescribing lifestyle changes for their patients, not just medications, which is so encouraging because they're reporting like amazing changes. And just recently I watched, it was in New York. New York is really doing some amazing work there. Some hospital adopted it and some providers included this, and they have all these classes and they are reporting some amazing stories of how people reverse a lot of their, not just diabetes, other conditions that before we thought we can never reverse them. So it's quite encouraging. Now, there is a study that was done on 59 patients with type 2 diabetes. This was like a clinic, a short-term. This is a short-term study that was done, just implementing a whole food plant-based to see what can happen if all these diabetics will eat right. Will there be any changes in a short time? Let's see. It says that the shift in diet, imagine, 22 patients achieved total remission, which is quite significant. That's 37%, right? And while the number of patients who needed to use glucose-lowering medication dropped from 40 to 29. To me, that's also very encouraging. And also, the number of insulin prescription within the group fell from 4 to 1 after just these changes were made. I find this very encouraging. Now, the two key characteristics of whole food plant-based diet supports that type 2 diabetes remissions are lower the total energy and lower total fat, which lead to reduced energy intake. This is Michaela Carlson, which is a senior director of research for the American College of Lifestyle Medicine and a lead researcher in this study. Now, the concept of eating low energy density foods with a low calorie count is a popular and proven method for long-term weight loss. This approach allows a person to eat a relatively large volume of food without gaining weight because the ingredients aren't highly caloric and they're often filled with hunger-busting properties such as fiber. Like, I always feel embarrassed at work when I take my lunchbox because my lunchbox is big, and some of my colleagues' lunchbox are like this. It's like I would be hungry in a minute if I just eat that little thing. So I eat a lot, but I eat a lot of foods that are high in fiber and low in calories, which really helps quite a bit. Now, just a little encouragement. I know making changes is always difficult, but we do have the promise that we can do all things through Christ who strengthens us. If God is on our side, who can be against us?